Wow. It is an amazing experience to see 3,000 or 4,000 people who can spend 2 days thinking about prevention. But you know, wow, we have such wonderful knowledge about what to do, prevention, and I've heard 2 political speeches saying, we're great in Munich, we're great in Bavaria, but we want to be better. What I'm going to talk about is how they might be better and how other people working on prevention in Germany might be better. My main message is about crime victims, sir. I'm president of the International Organization of Victim Assistance, and I'm a passionate advocate for crime victims. The main reason why we need to get balanced funding to implement what works in prevention is for crime victims. 1985, every government of the world agreed that it was time to realize that crime does harm to victims, and the criminal justice system doesn't make it much better. And part of what they said is we need prevention, social prevention, situational crime prevention, mobilizing individuals. They've changed my slides on me. No, they haven't. We're all right. The old way is this. The old way is to talk about reacting to crime. Do we have enough police? Do we have enough judges? Do we have enough prisons? The United States has taken this to a level that no other country can compete with. Staggering amounts of money spent on policing, reactive policing, reacting to 911. 2/3 of the $100 billion spent in the United States in reacting to crime goes into reacting to 911. What that tells you is that they haven't understood the message about prevention. 1 in 4 of everybody incarcerated in the world is incarcerated in the United States. You in Germany don't need to be convinced that adding more police and incarcerating more people will not arrest your way out of crime. What will bring you out of crime is using this knowledge about what actually works, about effective crime prevention. That effective crime prevention has to do with youth, has to do with children, has to do with violence against women. It has to do with using those police resources better, smarter. It has to do with balancing investment. When I hear what your president has been spending on prevention, on safety was his phrase, I want to see a balance. We have to move from just talking about prevention to investing in what works. For every additional euro that's going to go to reacting, there has to be a matching euro in prevention. For every discussion about how we move from this all enforcement, all reaction to prevention, we need to put money into shifting. Lower Saxony is one exciting model. There are many others. The European Forum on Urban Safety gives us many, many examples of cities across Europe that are trying to prevent. We need to support them. We need to put money where it matters. So, yes, we're concerned about the victims of assault who will turn up in emergency rooms. We're concerned about the women whose lives will be changed by violence. Scientifically, we can put numbers on those. These numbers come from the United States. And if you look on the left-hand side, the top column in red is the harm due to homicides and deaths on the road. The next column is the harm done to women by sexual assault. We have to talk about prevention in terms of reducing these harms. Yes, we must stop the deaths on the road, no doubt. But we must not overlook the importance of reducing violence against women, violence against children, and of much lesser importance, the assaults that bring people to hospitals. So what is this proven prevention? Where can you find out about it? The two very easy sources. Yes, they're in English. One is the World Health Organization, who are very active in the international meeting taking place here. In red, it's called The Evidence, and I'm going to tell you in a moment about the main conclusions from their report. You can also go to the US Department of Justice, the king of incarcerating people, the king of more police, the king of 911, the king of due process for offenders. On their website, you have crime solutions. And on that, you'll find what will work in early childhood, what will work with youth, what will work in stopping violence against women, what will work in smart policing. It's all there at the click of a mouse. If you have your iPad with you here, you can go on that website. When I teach students, they've already gone on these websites. They're easy for politicians to see. They're easy for you who are committed to working in making a difference, to reducing the number of victims. They're there for you to see. Now, I consider myself a scientist, and I'm proud of that. But I'm also proud that my message is now the message of the super cops. Bill Bratton, the guy who claimed to have reduced violence in New York City in the 90s. Exaggerated a bit, but anyhow. He says we cannot arrest our way out of violence. If you go to the international meeting here, you'll hear the chief of detectives from Glasgow, from Strathclyde, say the same thing and doing something about it. The super cops now are talking about investing in prevention, the same stuff that comes off those websites. And they're calling for it to happen, and they're calling for investment in it. They talk about investing in partners. Now, there are many police here. So yes, you have to be the next super cop and pushing for investment in social prevention, but there are many things you can do. And indeed, many of the exhibits here show that you're already doing it. But you have to do it more. This is another website in the United States called POP Center, Problem-Oriented Policing. So what are the things that the World Health Organization says work? And they're not the only group that says this. Habitat, who's present here, European Forum endorses many of these things, and so on. The first is early childhood. I haven't yet found the Triple P exhibit here, but it was certainly there in Berlin. We know that you can reduce child abuse by investing in better parent training, and we know that this reduces youth violence and it will reduce vandalism on trains. It'll reduce assaults that lead to people in emergency rooms, and it'll reduce violence on the road. Yes, there are old people like me who drink and drive. I don't drink and drive, but my old people like me, not me, who drink and drive. But a significant number of the people who kill on the road are the same people who are involved in assaults and vandalism. And we can stop that not just through deterrence, which works for me, but through investing in early childhood. We know that focusing on youth, mentoring, creating youth inclusion projects for those youth who feel excluded, a British invention. By the way, this wasn't one project. The British, smart guys over there, they took one project, they did it in 72 areas, they evaluated it, showed it worked, so they're now doing it in 130 areas. That's a model for any country in Europe. You take something that works, you put money into it, you evaluate it, and you spread it. Yes, knives, beer bottles, some places handguns. These are the people who come to emergency rooms. Again, the smart British have gone from those emergency rooms to go to the bar where those people came from, to look at what they can do about knives and bottles. We know that if we organize neighborhoods and we work with individuals, we can have spectacular reductions. This is funded by the insurance company in the province in Canada called Manitoba, 85% reduction in car theft. I'm not selling it to you as a reduction in car theft. What it does is it shows you, as the previous speaker said, that if you diagnose and implement and spend money, you have to spend money on prevention to get results, then you get those results. This is Glasgow. Police said, we can't arrest our way out, so what are we going to do? We're not going to do straight away, by the way. We're going to diagnose, why do we have so many people injured, killed? Where do they come from? How can we intervene in the early childhood, in the youth years? How can we stop them with the knives? How can we plan to do something about domestic violence? What are we going to do about alcohol? 50% reduction within 3 years. 50% reduction within 3 years, inspired by a super cop. And yes, he knew that he had to work with others. He had to have a public health analyst, a woman, to help him do it. And then he had to get money to do it, and he did it. Violence against women. I've already told you that for me, it's as important as violence on the road. It does in many ways the same amount of harm. Canadian success story. You get to young men while they're in school and you teach them what is a sexual assault and how to meet their needs without violence. A random control trial showing incredible results. You can find this, by the way, on the U.S. Department of Justice Crime Solutions as a promising practice. This is a fantastic practice. Every school in Germany should have a program that is based on evidence like this and probably on a program like this. Mediation has been mentioned. Restorative justice, we have incredible evidence that not only are victims happier with these programs, but they reduce recidivism. The UK now has a universal program without the sort of money I think should be there on restorative justice. So these are 7 well-proven items. Now, these give us an incredible return. This is an old report done in the UK on cities. This is a report in California. For every $1 that they invest in California on programs that have to do with early childhood and have to do with youth school. They could have saved $7 in their prison programs that are making them go bankrupt today. Americans, very generous people. They've actually now got a website that shows you how much, this is Germany, I know you want return on investment. You can find out how much you can get in terms of social return on investment, at least according to the American studies, by going on this website. So what's the return on mentoring? What's the return on youth inclusion? What's the return on early childhood? These returns are amazing. Wow. There is no other word for it. We've heard a little bit that if you're going to implement prevention, you have to do it through planning. This is the secret to planning. Yeah, I know you don't like diagrams. There's no picture here. But bringing together the key agencies in the city to plan how those agencies are going to influence the risk factors is the key to successful prevention. I'm proud that we now have a province in Canada, probably almost as rich as Bavaria, and probably almost as with a reputation of not being left-wing. And what they've gone for is a braided strategy. Braided means you bring together the school, housing, social services, and policing, and you see where you can make a difference, and you make a difference. It's balanced. Yeah, they added some money for policing and prisons. They added some money for treatment, but they added the same amount of money for investing in effective prevention. And they got elected. We've done a lot of work in Canada at the city level, and you can see from the material that's been given to you in German where you can find out more about this. But we've actually produced material so that decision makers can see how they can implement and how they can influence, reduce violence against women, reduce property crime, reduce violence on the streets. Waterloo Region has a German-speaking executive director, so please go and listen to her, and she will explain how she moved from agencies not spending on prevention to those spending on prevention. So, what's the bottom line on this? The bottom line is simple. We know through scientific, proven evaluations what has worked to reduce crime. We know that we need to focus better on those kids who don't receive the early childhood experiences that they should. We need to focus on outreach to youth. We need to change the culture of violence. We need to focus on reducing violence by men against women. And we need to look at restorative justice. We also know that we need to use those police resources much more smartly. And I'm not just talking about public involvement. I'm talking about enforcing laws relating to alcohol, even in the Oktoberfest city. I'm talking about what you do to control weapons, be they beer bottles, be they knives. And yes, we need to do something about prolific offenders. But we need to do most of those things much earlier on. And we need to make sure that the policing community, like those super cops, supports prevention. It is vital that the police among us here today, that you argue not just for your own budgets, but for realistic budgets for the people who will implement these things. So I started off by talking about balanced investing in proven crime prevention. And I want to repeat that message. If you can afford to put money into security guards, or into police, or into prisons, then you can afford to put money into effective prevention. The prevention people are coming from behind. Just as we couldn't ever say, men and women are equal, so we'll just allow them equal chance. We knew that if we're going to help women to become equal, we had to help women to become equal. It's the same in the prevention area. You can't simply say to a small agency, you fight for money and we'll fight for our 2 or 3%. So you have to look at the amount that the established system, reactive system, 911 system, prison system, we have to look at what money they can get and match it. And that's how we will see the harm to victims reduced significantly. And if we could just shift 5% of what is currently being spent on reaction into what works, the levels of violence against women, the levels of property crime in Bavaria, even in Munich, in Germany, could be really reduced by 50% or more within a 3 to 5 year period. Now, I'm happy if the politicians say, we'll do it over 10 years. But the facts show that if you do it and you invest, you can do it within 5 years. And what you have to do that is you have to legislate and establish permanent boards to make that shift. The subtitles in English to this say, if you understood what I said, then you are responsible if the harm continues without you getting the changes that we need. Thank you so much, the sponsors, Eric, for giving me an opportunity to share with you. There is now a book in German that you can read what I said in English in your language. But it's not just reading that matters. It's acting on this statement to make a difference to the real investments in prevention that will reduce harm to women, to children, to families, and will make Germany, a safe Germany, a safer place. Thank you so much.